Hello, everyone. Welcome to yet another Clean Health Masterclass. Today, we have Accredited Dietitian Astrid joining us today, and we're going to be discussing all things nutrition for women. This has been a hot topic for our students, so if you guys have any questions for us live during the masterclass, drop them in the chat. But we have a lot to cover this masterclass, so without hesitation, we're just going to dive on in by Astrid, giving us a little introduction to who you are, your studies in the industry, and what you where you're positioned at currently.
All right, so I have been a dietitian for about 15 years. I did my initial bachelor's degree in South America for about 5 years. Then I did my practice, or pretty much like a 3 years of practice. I was doing a lot of workshops teaching personal trainers and general population about fitness, nutrition in general, how to do their own nutrition and lifestyle. And then when I moved to Australia, I did a master's degree for about 2.5 years in Bonn University. And finally, once I graduated, I worked as a private dietitian in a hospital that pretty much focused on rehab and mental health. So that has been for about 5 years already since I graduated. I'm getting old. But this is pretty much in a little summary what I've been doing professionally. And on the side, being a dietitian coach for probably the same amount of time I've been a dietitian, but it's been a bit of a different focus, and where I really have evolved a lot in terms of my approaches, the way I work with clients, the different points of interest for me. It's been a very wide. At the beginning was more like, oh, well, I focus on the most common things that would be weight loss, fat loss, and some diet changes to improve lifestyle. Since here, I've gotten to a very deep focus on mental health, mindset, and women, how women face the challenges across the board in their lifespan, because there are different things that will be a challenge more for women than for men. But that is not to say that men also struggle with mental health, binge eating, emotional eating, and their own challenges as being human would be. So definitely a big, strong focus that I have right now is emotional eating, mindset, and how to find a much better balanced approach for your nutrition that really focuses on sustainability, and whether that for you looks in a different way to other people. That is why I think that individualized approach is so huge. And obviously understanding that an individual has way too many different things coming to each person. Like, you will find that one person will have their work, they try to balance their family, their nutrition, their goals. So there's a lot of different things that you need to be aware of for you to really give them the best advice, and sharing with them to allow them to thrive with you.
Yeah, and understanding, and we always say this as coaches, that we are working with human beings, not robots. So it's really important to understand that everybody's that you work with comes from a different walk of life with different circumstances. And that's why having a larger toolkit of knowledge allows you to show up as the best coach that you can be for your clients. And for today's masterclass, we're going to be talking about different circumstances and issues that women may be facing in their lifetime, whether it's PCOS, going through menopause, pre and postnatal, IBS. We're also going to be talking about developing a healthy relationship with food and what that entails and what we can do as coaches to encourage that. as well as talking about optimizing nutrition and training during the menstrual cycle. So we're going to start off with talking about, and this has been most requested as we have not had this type of coverage. You might have seen this type of information on our IG Live. So if you follow us on Instagram, you will see that we've had brief discussions on these topics. But we're going to talk about, we're going to start diving into what PCOS, menopause, pre and postnatal, and IBS are, and optimizing nutrition approaches specifically, as well as training. So Astrid, we're going to kick off the conversation with a highly requested topic, which is PCOS. So talk to us briefly about what that is and what are some common symptoms that we may see in our female clients who are diagnosed with PCOS.
Absolutely. So PCOS is a lifelong endocrine disorder, which probably has an unknown etiology or origin and has a meaningful long-term health implications. So it is characterized by the presence of hyperandrogenism, which is high level of male sex hormones or testosterone, and some dysfunction at the level of your ovaries. So women with PCOS can suffer from gynecological problems such as amenorrhea or even menstrual cycles irregularities. And even getting to a point that they have a high risk for developing type 2 diabetes or cardiovascular disease or even metabolic syndrome. Yeah. So one thing that is very important or being utilized at the moment is a 2018 international evidence-based guidelines that endorse the Rotterdam criteria as one of the best tools to diagnose PCOS, which requires at least 2 of 3 of the following conditions. So we're talking about hyperandrogenism, irregular anovulatory cycles, and polycystic ovaries. So if you either have 2 of these, you can be diagnosed officially with PCOS. So obviously there is a really high amount of women get undiagnosed and they're not diagnosed or misdiagnosed for many years of their lives, and then probably, and especially most recently, that PCOS have gotten a bit more attention to what their priorities are and why it is so important to pay more attention to this condition. It's been taken more into account, and I think the more evidence-based guidelines have been developed to ensure the diagnosis is accurate and it is more robust for these women. So the adequate information can be added from the very beginning rather than giving confusing advices that will just make things much harder for these females to have a better quality of life overall. So that is the basic explanation of what it is. And maybe if you want, we can go a little bit deeper into what the nutrition is important for, why nutrition is important for this type of clients, or like even going training even these clients.
Yeah, let's talk a little bit first about nutrition. And one of the common topics about nutrition is the myth that low carb diets are superior for PCOS. So give us the insight that you have when it comes to nutritional recommendations, and then we can talk about training afterwards.
Of course. So lifestyle management is going to be the first line of treatment for PCOS, and it's going to be typically involving diet, but also exercise interventions aimed mostly to improve insulin sensitivity. In the majority of women with PCOS, there is a good chunk of these women that will experience some troubles with insulin sensitivity. So that is one of the type of PCOS that we want to focus the most on when it comes to nutritional management for preventing chronic disease in later years. So there is obviously lots of different advices out there about what nutrition should be for PCOS and insulin sensitivity and those things. But despite all the internet gurus confidently say this is diet for PCOS, there is no size fit all approach for PCOS.
Yeah.
And you have to coming back to what I said before. It is very individualized, and you gotta look at the individual as a whole.
Yeah.
There is little evidence that there are different diets are superior for this condition when we think about energy and protein equated diets.
Yeah.
So we know that carbohydrates and insulin sensitivity are a bit of a sensitive topic for this particular condition. So even though, like, for example, low glycemic index is very recommended to get these clients, this type of patients, to use it, the therapeutic role is not really clear. And obviously low glycemic index diets are definitely beneficial in the sense that you're increasing the nutritional density of your actual diet, because when you're choosing lower GI carbohydrates, you're probably choosing more higher fiber sources, more vegetables, and more wholesome whole grain carbohydrates, which at the end of the day are more nutritious overall.
Exactly.
But there is some research that suggests that they have been shown to reduce insulin resistance, total cholesterol, and improve menstrual regularity and quality of life. But again, I think all of this comes back based on that this is you more nutrients and providing you more fiber, and overall makes you feel fuller and you may eat less overall.
Yeah.
So I think that is why that is being recommended for the most part. On the other hand, and one of the obvious benefits of low GI diets is that they will obviously result in healthy eating patterns. So as I said before, there will be a much more emphasis on complex carbohydrate sources, high dietary fiber intake, and a shift potentially to unsaturated fats in place of saturated fats, which at the end of the day leads to a better micronutrient composition and lower energy intake at the end of the day.
Right.
Other things that are really important to mention for women with PCOS is that really at the end of the day is looking at the whole composition of the diet that is going to be adequate for them in order to consistently follow it.
Exactly.
And when we think about some studies and some research that is trying to point out what are the best dietary approaches that are going to be beneficial for women with PCOS, there is a wide variety of those, basically just showing that women will be more adherent to something that they can adhere to, and that can facilitate better long-term health improvements overall. So if we focus on managing weight in this particular type of patients, and therefore maintaining a healthy weight and overall healthy habits, that will totally lead them into a healthier pathway and reduce any chances of having hypertension, metabolic syndrome, or even type 2 diabetes.
Yeah. I think also to add to that, one of the common things when it comes to women who are diagnosed with PCOS, they're usually told by their primary care doctors, now again, not all women diagnosed with PCOS are overweight. It is just recommended by doctors that if you are overweight, to lose weight in order to alleviate some of those symptoms. So oftentimes they are told by their general practitioner that they need to lose weight. And then, of course, out of desperation to do so, oftentimes they dive into very drastic approaches, whether it's cutting out, something like carbohydrates as a macronutrient, slashing calories drastically, talk to us about why that is a bad idea, and how as coaches we can encourage women to get more comfortable with properly nourishing their body and still hitting that goal and checking off what, if they need to have weight loss as a target, how they can achieve that without being so drastic and still, sustaining that nutritional approach with everything, being, prioritizing their health alongside with that.
I think when it comes to nutrition and really achieving something that is sustainable for you, and understanding as women and human beings, we are not just human beings that wake up, eat, work, and do something. We have emotions, we have challenges, and we have lots of different things that are going on in your own life that are going to dictate how you respond to certain challenges and how things can go over time when you decide to do certain things. So when we think about dietary approaches that are too aggressive, they tend to be very restrictive, not just but at the level of the cognitive restraint, the discipline that person needs to implement. And most times they also tend to get the person to be so limited at their choices. There is so many off-limit foods that it is automatically going to create a feeling that there is a scarcity with certain things. This is going to limit their quality of social interactions. There's going to be limiting their own mental health and the relationship with food. So when we take into account that human beings are not just robots, but we also have a huge amount of different feelings and things getting into our daily life, that is going to be something that we need to pay attention to and consider when we think about restrictive diet, and not just for PCOS, but for anyone who is trying to lose weight or just follow a very aggressive approach. How sustainable is that for you, and how disruptive is for you in terms of your relationship with food, your relationship with your family, or your social environment, your day-to-day life? How much disruptive is going to be that, and how restrictive can that be? How many foods limits do you have that you actually enjoy and you feel like it's something that is kind of taken away from you because you have to avoid that, or they are not allowed in this particular diet? And obviously that makes things much harder. And when we come back to what the evidence base says about weight loss and sustainable, successful fat loss phases, you see that the ones that can adhere to the most and like has the least amount of friction and easier to follow are the approaches that are the most sustainable and the most healthiest for that particular individual. So that is coming back to, you gotta find the approach that you find the most easiest to adhere to, that has the least amount of restriction, and you can still find that you are going to be getting results. And that is in focus for you, is finding what really works for you as a person, as you're aligned with your preferences, with your principles, with the way you like doing things, and with your lifestyle, and go from there. But you don't need to specifically, if you have PCOS, to cut out specific foods, unless obviously you have an allergy or the food is actually something that you cannot digest properly. That is very specific. But overall, it is not a specific you have to live, because it is going to create deleterious effects on your health, given you have PCOS or not.
Yeah. And so following up with that, what would you say are general recommendations for PTs to provide for their clients to just optimize their intake to support, a PCOS diagnosis, regardless if it's weight loss or maintenance of weight? What are some things that the client or athlete can do with nutrition to optimize their position and minimize symptoms? What are some things that they can do when it comes to food choices and options?
When it comes to food choices, you really want to focus and pay attention to the quality of your choices, obviously. Again, I think one of the things that I like the most about having a diet is to obviously understand you, or 80% of that nutritional choices have to be nutritious and full of a variety of micronutrients, and obviously a balance of macronutrients as well. You want to prioritize protein in the game because it is definitely something that is going to help you across the board because of all the benefits that protein contains to begin with. And it will also help you to have a much better building of your lean body mass, which is pretty much so important for you to have a much more healthier body, much more longer term when we think about insulin resistance and insulin sensitivity. So having that lean body mass and less body fat mass will help you to have better insulin sensitivity overall, and obviously reduce the chances of having metabolic syndrome or type 2 diabetes.
Right.
So nutrition wise, actually there are not so many things that we need to stress so much about. Just keeping it very simple. I would definitely suggest that you have less fats and more polyunsaturated and monounsaturated fats. That is basically choosing plant sources of fats like nuts and seeds. Very, very good taking like oils from, or utilizing a small amount of oil from plants that are quite nutritious versus compared to the ones that contain a lot of saturated fats. Obviously, you don't want to be adding oil to all your meals, but what I'm saying is swapping when you're using fats or adding fats to your diet, swapping that for those that may contain omega-3s, omegas, and just be more aligned with your heart health and overall health. Apart from that, really increasing your fiber intake, which is probably something that comes along with choosing better quality carbohydrates. And when it comes to carbohydrates, it's really a matter of choice, quantity, quality, frequency, and portions. But there is no specific a bad carbohydrate or that having sugar or wheat, or like you have to go paleo or vegan. None of that really is evidence-based, and you gotta go back to the basics. Nutritious diet, high protein, high fiber, good fats, frequency, quantity, and portion sizes is going to be pretty much the ballpark of what you need to focus on.
And then what about training recommendations? Why is training so important? And we know we're going to touch base on this with all the things that we're discussing, but specifically when it comes to strength training, how does that benefit a client that is diagnosed?
Well, I guess exercise has been shown to improve several metabolic, cardiorespiratory, anthropometric outcomes in women with PCOS, including fasting insulin, androgen levels, lipid profile, blood pressure, even like your body composition and waist circumference. So the guidelines for managing PCOS and providing this advice is pretty much to engage with regular exercise. It doesn't necessarily have to be strictly resistance training, although that is one of the most beneficial ones. But if you just do exercise and meet recommendations of physical activity, let's say 150 minutes per week of moderate intensity or 75 minutes per week with a vigorous intensity, that is already a good starting point. Now, if you want to add much more benefits from this, in terms of not just health benefit, but physical benefits, you can definitely include the combination of not just the exercise coming from the cardiovascular or endurance type of exercises, but also the resistance strength training component of it, which is going to provide the base of both worlds. There has been a handful of randomized controlled trials that have given this either just vigorous exercise and cardiovascular exercise, or resistance training, or both, and they have resulted in that just exercise overall is going to be beneficial for reducing any chronic health disease, specifically in this particular population. So
Gotcha.
I would definitely recommend to have a combination of both aerobic and resistance training, as they will definitely be reducing insulin resistance if that is a concern, and also everything that can come with just resistance training and reducing or improving BMI, waist circumference, and even improving VO2 max, which is one of those parameters of health that usually gets forgotten. And it really represents how fit you can be as you age. So it is really important to also take advantage of getting that exercise, not just for the sake of being stronger, but also for the sake that you're physically fitter as you get older.
And I think in general, when it comes to recommendations for training, there are a laundry list of benefits, regardless of the situation you're in, to be active, whether it's walking, aerobics, resistance training. You will see a trend amongst all of the conversations we're having today that it does come up that it is always recommended to have that level of activity as a basis of your routine. Now, for our coaches that have a niche for coaching women, it is inevitable. The probability of having a woman become pregnant during that time of your coaching is something that coaches should have it as an expectation, especially if they are coaching women. Let's start talking a little bit about prenatal, postnatal. What does that mean, and what coaches can do to be well equipped if they find the news that one of their clients has fallen pregnant?
Yeah, absolutely. So we need to really think about nutrition in all stages of life. So obviously, when we think about nutrition overall, you want to, and if you're gonna be becoming a mother, your health status can be improved by increasing awareness and knowledge, obviously regarding key nutrition and life guidelines around pregnancy that probably will likely impact positively on not just you as a mom, but also as a baby. So obviously we want to think about the different stages and how nutrition strategies may change slightly as you go through each stage. I'm not just talking about the specific calorie intake. So like important is for you to prepare your system with a specific micronutrients that tend to be very key in the context of the development of the baby when you're during pregnancy, and how important it is for you to be aware of those things. So when we think about stages, you want to think about pre-pregnancy. So when you're planning to get pregnant, I think it's super important and a good practice to optimize your nutrition before conception. And that is going to obviously guarantee the mother can meet metabolic and nutritional demands of the entire formation of the baby development and feel confident that there is enough nutrients coming in, not just for her to handle the pregnancy, but also to provide everything that the baby will need. The problem seems, or the challenge seems to be that many women lead unhealthy lifestyles before they get pregnant, or even during the early stages of pregnancy, until they realize they're pregnant and is probably a bit late, which can be detrimental. So, for example, a poor quality diet, which insufficient micronutrient intake or minimal levels of physical activity or regular smoking or alcohol consumption, it's something that probably women should try to be aware that is not beneficial and can be, or can increase the risks during the pregnancy period. So it is super important that these lifestyle modifications start when you're planning to get pregnant. So there are things that you can put in action to reduce further consequences as you go along. And there is also research providing that events like a systematic reviews and some studies that have shown that obese women that being or being pregnant can increase the likelihood for the child to have issues with the weight when they are already, when they given birth, and they have higher rates of, like, the pregnancies overall are much riskier. So there are the two things that you need to pay attention to is not just the nutrition quality, but also how you're preparing your body to get pregnant in the first place.
Yeah.
One of the main things that you really want to pay attention to when it comes to micronutrient selection and preparing to get pregnant is making sure you're having awareness of importance of folate, iron, vitamin D, vitamin B12, and iodine, because these ones play the biggest roles when it comes to the formation of the neurological system in the baby and ensure a much healthier pregnancy and development for the baby.
Yeah.
I'm not sure if you want some specifics, or you want to go moving to pregnancy.
Let's talk a little bit about specifics, and then we can go into like actual pregnancy as well.
Okay, so in terms of the specifics, when I am talking about women, if women are trying to conceive, it is recommended to pay special attention to their macronutrient levels. So that basically you can get that information when you get a blood test, specifically looking at folate, iron, vitamin D, B12, and iodine levels and iron levels, because that gives you a good picture of what your baseline is and whether you need to be supplementing adequately for a period of time, at least 3 months before you even try to conceive. So you're in a much better state. So a good preventive measure is to have a well-balanced diet to begin with an adequate micronutrient and even taking multivitamins before conceiving. This can be achieved obviously by including more vegetables, more plant-based whole grains, vegetables, legumes, fruit, and seeds. And if your client is vegan or vegetarian, you probably will need to recommend them to have a supplementation with vitamin B12, folate, and iron. And generally, most women could potentially benefit from supplementing with perhaps fish oil to improve their stores of essential fatty acids before pregnancy. But I think with this specific recommendation, you probably can get away by adding at least 2 serves of fish per week. And even like a fishy oil like salmon, sardines, or mackerel can be a good option for you to just have that extra amount of omega-3 fatty acids coming into your system just from food. And if you decide to supplement, then that's another way that you can do it. The other thing that is really important is obviously taking folic acid supplementation, at least, and that is kind of the recommendations overall, is 400 micrograms per day during that preconception period, at least 3 months prior to conceiving and into the first semester of your pregnancy. So that has shown to be super essential to substantially reduce the risk of serious birth defects like neural tube defects as well. So this is super important, and I can't highlight more why the nutritional status of being a mom prior to becoming a mom and being pregnant is super important. So your lifestyle has to change even before everything starts.
Exactly. Yeah, and it will just make during the pregnancy a lot easier, even when it comes to training. Having that healthy lifestyle, strength, training prior to falling pregnant or being pregnant can really help you not only be able to sustain that during your pregnancy, but also with the actual, carrying your child, giving birth, postpartum, just having those habits already instilled makes it a lot easier than trying to instill them the minute you find out that you are pregnant. And I think oftentimes, and I've seen this with my own clients, is the minute that they do become pregnant, it becomes a big priority because now they're not only taking care of themselves, they're taking care of a little being growing inside of them. And they start becoming more mindful of, the things that they are doing when it comes to nutrition and training. And when it comes to that, now we can transition a little into, all right, your client has told you that she is officially pregnant. What does that mean when it comes to approaches that you may be having with your client? What are changes that us as coaches, we have to be mindful of making during that 9-month period of being pregnant?
During the pregnancy, weight gain, cravings, aversions, nauseas, and all of these, probably you will think about a roller coaster period when things can be totally unexpected. They're new to you, especially if you're first time mom. There are a lot of different factors playing in, from that physiological responses, from emotional roller coaster challenges with your actual, like, wanting to do something but physically feeling unable to do it because you just don't have the you have nauseous, or you want to eat better but you just can't hold food in. So there are different things that can be a very important challenge. When it comes to energy requirements, the main thing that I find that is very tricky is thinking that you need to eat for two, which is practically makes sense, but in reality, this would lead to an overestimation of actual energy requirements during pregnancy. So women with considered with a normal BMI, which is under 25 kilograms per square meter, only require just a small amount of increase of energy intake in these later stages in pregnancy when we think about the energy requirement given the different trimesters. So the current recommendations suggest at least an increase of around 85 calories per day only in the first trimester. Then probably around the second trimester, the calorie requirement increases all the way up to 280, 300 calories per day. And in the fourth trimester, the biggest is the biggest amount of calories that will increase. So the requirement will go all the way up to 475, 500 calories per day. However, these periods will have their own challenges, and because the last trimester seems to be the most challenging one, and somehow, even though your requirements are higher, your energy expenditure is lower, potentially because of you have a big belly, the baby's grown, much more grown up, your back is sore, there are like all the different things that are going to be affecting your energy expenditure overall. So it is kind of, your energy requirements increase, but your energy expenditure drops. So you got to be very, very mindful about how much you actually need to increase in this period, because it's kind of a fine line between, well, how is your energy expenditure going through all your pregnancy, whether it stays the same or goes down, especially in the later weeks of the pregnancy.
Yeah. And talking real quick about activity levels, and we'll go back to talking about nutrition, but when it comes to activity levels, I think sometimes, and I've seen this again with my clients as well, the clients who were active prior to pregnancy feel more comfortable training during pregnancy. Of course, as the baby is growing, so is the mom. So there's going to be a lot of movements that may not be optimal, safe, or ideal for your clients. And this becomes, really important for you to understand that even though your client trained prior, during those later trimesters, it's very important to be mindful of what your client is feeling comfortable with, where they're at with their actual pregnancy. Some movements may just be irrational to do, right? Or just due to the big obscurity of the big, big belly coming in the way. You can't do certain movements. It's not as comfortable. You have the pain in the back. So those are the type of things that, women encounter. But talk to us about the irrational or rational fear that women have when it comes to training and actually exercising during pregnancy, and what is recommended and what is, recommended to avoid during certain trimesters.
Initially, especially in the first trimester, there is no much fear to have when it comes to exercise selection, although you want to start being mindful about the choices that you're going to be making in order to prevent a lot of pressure on all that is the front of your abdominal wall, and obviously increase the pressure, intra-abdominal pressure. That can be a bit risky, especially if you have a baby developing inside, and everything that kind of brings high impact or just creates a lot of intra-abdominal pressure. What I think needs to be said is, if you have already a really good baseline, and as you mentioned, if you're coming with a background of lifting and exercise, you can continue doing that, but obviously you will need to adjust certain exercises, nothing pronated, nothing that requires a high impact or lifting very heavy weights to a point that you have to do like the Balsava maneuver, or you have to really push to do certain exercises or movement patterns. So it is really important to just bear in mind that those things can increase somehow the risk of creating that extra abdominal pressure and affect the baby's position, or create or impact, make some risk related to that. But other than that, you definitely are encouraged to continue doing your normal walking, being active, moving, stretching, doing the things that you have been doing even before you got pregnant, but with certain modifications also when it comes to twisting, or like I've seen in yoga, you have to do certain adjustments that are going to reduce those risky movements and create a safe training session or safe movement routine for that particular person. So I guess coming back to the essentials is do things that you have been doing. Try to reduce anything that tends to increase intra-abdominal pressure or high impact that will just, like that jumping.
Yeah,
I
just
imagine
the
the
heart
baby
rate up and
inside
like
like,
that.
no.
Exactly. Mixing up in the belly, right? Doing high intensity interval training and things like that. And one also thing that I bring up to my clients, and I think this is an important thing to note. And I even say this to my women who are not pregnant but are hesitant to lift weights, is that especially moms, they underestimate how much they lift outside of the gym when it comes to chores around the house, laundry baskets, carrying children, doing this. You know how heavy these things are and how strong our mamas are. So it's really important as a coach to remind them that they are strong and that they are empowered, and that they strength training is only going to be of a benefit, but of course doing so safely and to the comfort of your athlete or client. And of course, working closely with their a doctor and making sure that if there are things that they need to be holding back on, and as they're doing their checkups, it needs to be proper. There has to be that proper communication so that the safety of both the mom and the baby are always top priority, because at that time, there is going to be weight gain. Your body is changing. The goal is just to simply sustain these healthy habits. And then postpartum, when the baby is born, we could worry about rebuilding strength, losing any body fat and things like that, which kind of segues us into that conversation of, once your client has officially given birth and they have been cleared by their doctor to start training. Talk to us a little bit about training recommendations postpartum, as well as nutritional recommendations for getting our females back on track to prioritizing their health and mental well-being, because post pregnancy can be really hard for women, especially when it comes to having their bodies bounce back. And that's a common thing that really can trigger women mentally during after birth, giving birth.
I think it is very important to have being compassionate with that specific time, because I understand that when women they give birth, they kind of feel like they want straight away to go back to their pre-pregnancy body. There is a process of your body, sort of, you have carried for 9 months something amazing within you, but at the same time, the same process of 9 months, you can't expect your body just to be slim and totally fit and perfect the next day after giving birth. You actually spend probably around 4 months getting back to the shape you had initially before falling pregnant, because there is a physiological process of everything going back to how it was. Obviously, the first month is kind of the most important one, where you will still, after giving birth, you'll see that you still have your belly bump and you still look pregnant, but that is slowly going back down to what it used to be. That doesn't mean that you have to go straight after you have given birth and go into a diet. Your first few weeks, you have to really focus on creating that beautiful bond with the baby and focusing on nourishing your body as much as you need to create a good quality milk for breastfeeding, and encouraging yourself to stay compassionate with that period of time, because it's challenging to decide what is best for me right now. So after giving birth, you may feel like everything is kind of back to normal. You need to you no longer require more energy, but you do actually require about 500 extra calories per day to compared to non-pregnant women, to just simply create an adequate maternal milk quality and the total amount of volume that you need to produce for the baby, especially in the first few weeks of their lives. So, and even then, when you just breastfeed and focus on eating the amount of nutrients that you need per day to have just the energy that you require per day, you will see that it's very common to lose about 0.5 and even 1 kilo probably initially the first weeks are going to just you're going to be dropping a lot of weight because you're also losing a lot of fluid that was retained during that pregnancy. But after that, you will lose, probably is expected to lose about 0.5 to 2 kilos per month after you've given birth. So it is important to know that there is no need to really get into a very strict deficit. Just focus on having a balanced diet with adequate nutrient intake and high quality foods. So you can focus on breastfeeding, and you can, at least in the first 6 months, give your body time to get back to what it was before, and just feel comfortable by just having all the things you needed in the first place, and considering your nutrient requirements, and starting slowly going back to regular physical activity. You can definitely do that and achieve that without needing to restrict or slashing your calories, because while you're breastfeeding, ironically, you will be losing weight and body fat just because all that energy you had stored to begin with during your pregnancy is going to be utilized to create that high quality milk for the baby.
Yeah, and I also think it plays a big factor of comparing pregnancies to other women's pregnancies. Everybody is going to be recovering differently, feeling differently, and it's important to not let, especially with social media, the pressures of, bouncing back super quickly, which for some women naturally it can be easier, but don't beat yourself up if, your body doesn't look the same as it did before, giving birth to a child. Our bodies are going to be experiencing drastic amounts of changes. You literally gave birth to life, and it's really important to be kind to ourselves. And I know, regardless, whether you're falling pregnant or you're seeing changes in your body, we can become very hard on ourselves. So I really do think as coaches, we have to be that kind of emotional support system as well, to be, friendly reminder that it's okay to not bounce back month 3, 4, 5, 6, even a year. It could take that time, but giving that body the time to recover. And like you mentioned, prioritizing what needs to be prioritized when it comes to properly nourishing your body for being able to produce something for your child. And then once you are getting to that point, easing back into your training and nutrition. And it's not impossible. It's just your rate of change and going back can be completely different than your friends, your neighbors, your colleagues. It's going to be different. Every woman and body is different. When talking about training, what are some key fundamental things that coaches need to understand when it comes to transitioning back into training, and specifically strength training with women post giving birth? So usually around that 6-week mark is when they're cleared by their doctors. How do you navigate training going into starting up again?
I think initially you have to, and what is recommended is to focus on specific postnatal exercises that are going to increase the strength with your pelvic floor. Those things you pretty much start straight away. Most times this is recommended for those that gave birth like naturally. If that was like cesarean, that is going to be a slightly different recommendations, but you will still get the recommendations of working with your strengthening your abdominal wall and a lot of exercises to prevent prolapse and strengthening all the internal cavities of your abdomen and your pelvic floor as well. So that is the first thing that is recommended pretty much straight away after you've given birth. And a few months later, you are given the permission to start moving and not just walking, because pretty much walking is something that you will do normally as part of your routine, but it's going to become something more permissive as you move away from the postpartum period. And then once you have given the green light to start doing some exercise, you have to build up based on how you feel. You can't just go and demand yourself to be 100% after a period of not necessarily lifting anything for a while. You got to go very methodically and steady.
Yeah.
So I suppose it is really key to see where you're at that point in time, and focus on working slowly to building a new baseline, and getting from that baseline slowly as you feel good and you feel better, add a little bit of extra load or extra resistance to that particular movement. But you gotta really connect to how you feel at that point in time without
Yeah.
trying to hit PRs or anything like that. You just want to, in the first 6 months, you really want to just connect better with your body, strengthen your abdominal wall and your pelvic floor,
Yeah.
and get into a healthy routine, moving, that it will also be sort of an escape to manage stress, to help you sleep better, because there are a lot of different challenges during these first 6 months that obviously are not just in your control, but a lot of things are out of your control. So it's finding that fine balance, and exercise can be a really good outlet for you to sort of canalize those things as well.
Yeah. And just like anything, when it comes, it's taking it nice and steady, and it's all client dependent. If your mom is feeling good and she's feeling energized and she sees her strength starting to progress, then that's a go to keep on continuing that progression. But it's about being realistic. And oftentimes, especially for first time moms, it becomes kind of a surprise how much time is going to be consumed to nurture and care for the baby, especially if that's their first child. So it's really about maybe, they were training 1 to 2 hours a day, 5 days a week. They were on top of their nutrition. And then, it hit them that they are now a mom and they have to care for, another human. And it's going to consume more of their time that they can't afford, 5 hours a week for training and prepping their meals and doing those things. And as a coach, we have to really provide the tools to build those habits back up, because like, at the end of the day, when you have that shortage of time, it's not that much of a priority to care for training and this when the baby needs that time. So it's important to have tools in our toolbox as coaches to provide, simple things, going back to the basics, just activity and movement and properly nourishing. And then we can worry about the precision and strictness of diets and training regimens as well.
Absolutely.
Yeah. So in summation, oftentimes, if you are being a female, you are coaching females, you are going to encounter potentially one or two of your clients, if not more, falling pregnant and after. So if you are not feeling comfortable to guide your clients during pregnancy, it is okay to outsource and have them find someone who is able to help them. And I highly recommend, when it comes to education and you are coaching women, pre and postnatal certifications are all in for helping you be equipped with the knowledge that you need to help your clients who are pregnant and pre-pregnancy, post-pregnancy, with all the knowledge you need to help them during that time. So I highly recommend that if you are coaching women. It's just something good to have as knowledge, because it's inevitable to not have that happen, right? Just as pregnancy is inevitable for female clients, so is the part of life where women experience menopause. So let's talk a little bit about what menopause is, when are these changes expected for women, and what these changes are.
Right. So when we think about menopause, we can think about this as a period of time that is dictating a change in their life for women. It is the end of menstruation. And in order to tell that you are actually a menopausal woman, you have to be without your periods for 12 months without no bleeding. If you tend to have bleeding, let's say in the 8th month, you have to reset the clock and kind of start counting again those 12 months consecutively, so that will give you the sign that that's when menopause has come. Obviously, there is a lot of different symptoms and signs that you will start experiencing before that actual time of point in time that is the menopause comes in time. Like, let's say you may find that you struggle with irregular periods, stress, incontinence, depression, hot flashes, sleep problems, mood changes, weight gain, slow metabolism, weight loss,
Yeah.
loss of like actual breast fullness, short-term memory, brain fog, night sweats, fatigue, anxiety, bloating, lots of different things such as loss of sex drive as well.
Yeah.
What else I can say? Well, even like palpitations,
Yes.
worsening allergies, breast pain. I cannot say anymore. Like cold flashes, hair loss,
The list
like
is never
lots
ending.
of different things. It's a huge list that probably seems like a never ending. And all of these are mostly accentuated during that perimenopause. After
Yeah.
perimenopause, and you have sort of gotten 12 months with no periods, then it's kind of when you can say, I just started the menopause, my menopause. And after that period, sort of like this is what month 12, I haven't had any period, I'm in menopause. Then we kind of enter in the postmenopausal period, which is basically when we think about feeling or getting the same symptoms, but they're going to be potentially less accentuated because now this roller coaster of hormones, estrogen and progesterone during that perimenopause are much more defined to, okay, now what is low, what is high, and
Yeah.
things pretty much are very, very low, very much more steady. Obviously, the symptoms at this level or at this point in time are going to be more, there is no hormones to counteract or do the role that they were doing before that happened. So that is when you start feeling some of the symptoms for these hormones lacking in the first place.
Yeah. And I think, real quick, I don't think we mentioned it. What is the common age that we see this hormonal change in women?
Oh yes, sure. Yeah, so perimenopause ranges for from women to women. I have seen from women from early stages of 35, 40s already having some of the of these specific symptoms that you may start experiencing. The overall age seems to be over 40s, over your 40s. Is it kind of lingers the first like around a decade before you actually hit the actual menopause. So that can be 35 to 45 or 40 to 50s. Some women are very lucky and they just 45 to 55 and they just get the menopause around the 55 mark. My mom, for example, she's 53 and she's pretty much still around that perimenopausal period. So she's still seeing her cycles. I have clients that they are 57, 58, and they still have their period. So it is so varied depending on each person that you can only say there will be a period of about 10 years where things may go up and down. When that starts, you don't really know until you actually have that 12 months consecutive that you haven't seen a period as such.
Yeah, so it really depends on the, woman to woman basis, and the type of symptoms that you are expecting, again, are very different from woman to woman. So it's really important to understand what changes the body is going to be going through during that time so that when that time comes, it's not more of a shock and a shutdown, but you have the tools to navigate that with confidence, because it's going to be a time where it's the inevitable, and we kind of like, it's a hesitation of like, we don't want to get there, but fortunately, living long enough to enter that type of phase of life, we have to embrace that with open arms and accept that. And that's going to allow women of those ages going through menopause to really embody that confidence, to navigate that it's not the end of life. It's, you still have the opportunity to be active, to be prioritizing your health, to reach the goals that you set for yourself. So talk to us a little bit about what are some key nutritional recommendations that you would note that are important during this phase of life.
Sorry, you cut out a little bit. What's the question?
What are some nutritional recommendations that you would recommend for coaches to recommend for clients during this phase of life?
I think it pretty much aligns with what I've been saying from the very beginning around the quality and the mindset, in terms of knowing that you can't just diet your menopause away. You need to really focus on, again, balancing out. And I think we have spoken about this before. If you enter menopause with really healthy habits, with a adequate lifestyle, when we think about training, a good high active lifestyle and a very healthy diet, it is much smoother for you to prevent and reduce risk of for you to gaining a lot of weight, or just experiencing a sort of reduction in this, expecting a lot of changes happening around this period of time, because you already have a good baseline to begin with. And sometimes, if the rest of the aspects of your life are in a good place, most of times you can say that women with menopause are able to still hit their goals, hit their nutrition. The thing is, priorities change, and a lot of things as we age change in our interest. Maybe we're just focused on different things, and we tend to reduce the level of attention we were giving at one point to our nutrition or our body, your physique or resistance training, because we start realizing as we age that your physique is not necessarily everything you need to pay attention to. There are other things that also have importance, as well as noticing that you don't need to be at the gym 8 times a week, 5 times a week. You can just go and have a really good routine that is give you the adequate amount of volume, the adequate amount of resistance, and challenges you enough to preserve or maintain what you've got. Obviously, it is going to be different depending on what your goals are and what you want to achieve. But that strong baseline is going to be predictive of how your routine may look like as you enter menopause. You want to still hit resistance training and make it more a higher priority versus just the cardio components. As I mentioned before, both are super important for any condition, any women at any point in time. You have your cardiovascular exercises to increase your VO2 max, to work on improve serotonin, to make you feel better, to drain or canalize stress and improve your mental health. But also you have the resistance training that, in addition of all the benefits that I already described for your cardiovascular exercises, you can canalize stress and improve mood and everything else, again, with the same resistance training. But in addition to that, resistance training adds that extra stimulus to your bones to stay strong as you age. And this is one of the main things that you want to prioritize, because once you hit menopause, the risk of osteopenia and osteoporosis increases hugely. And that is one thing that will help you to prevent as much as possible that bone loss. And it is being shown that maintaining a good routine with physical activity and resistance training will decrease that reduction of your bone mass density as you age.
And just again to touch on that, you see that there is that trend where, training is a benefit through all stages of life. And why, as coaches, we do recommend, training and staying active so that we can optimize health. And, for some periods of our life, the aesthetics and how we look is going to be a priority. But at the end of the day, it's about optimizing our health so that we have that longevity of life and, that duration of prioritizing our health and wellness before, we encounter issues or, using that to our power to control the most that we can by nourishing our body properly, staying active, and we see that through all, phases of life. Now, going into one more topic specifically for women is when it comes to menstrual cycles. And there are two scenarios where it can be a little bit different. So talk to us a little bit about, the parts of the menstrual cycle, as well as, the differences of a natural menstrual cycle versus, a client or woman who is on birth control, and do they experience those similarities? So briefly talk to us about, what the menstrual cycle looks like for a woman.
All right, so let's talk a little bit about physiology. We know that the cycle have overall two main parts. We have follicular phase and luteal phase. However, you can divide this follicular phase in early stages of follicular phase and late follicular phase, as well as your luteal phase divided in early luteal phase and late luteal phase. Looking at the whole picture, day one is the day you bleed, the first time of bleeding. That is when women begin to bleed and the lining of the uterus begins to shed.
Yep.
At this point, female hormones, specifically estrogen and progesterone, are at their lowest point, as they just have fallen off really quickly prior that day of bleeding. So in this point in time, your brain, the hypothalamus, which is kind of the command and control center of the endocrine system, signals the pituitary gland. Ovaries need to start follicle maturation and sends FSH, which is the follicle stimulating hormone, to start producing estrogen. So the follicle that contains the eggs starts to produce and secrete that estrogen during these first 2 weeks of your menstrual cycle. This is what is called follicular phase, because estrogen is going to be dominant and be produced for the most part by follicles. So this way, while the follicle is developing, in this first week, estrogen is pretty much increasing slowly, and estrogen pretty much stays relatively low because obviously there is nothing to produce that one yet. And in the second week of the cycle is when pretty much estrogen hits the highest point. When this follicular phase, when we think about, as I mentioned before, there is the early follicular phase, which is the bleeding part of the follicular phase, the first 7 days when you have your cycle. You will see that estrogen is still low, but is not as high as late follicular phase, which is kind of between this day 7 and day 14. During this late follicular phase, when we look at the second phase of this same follicular phase, you will see that there is going to be something that is going to disrupt this phase, which is when your hypothalamus tells your body to secrete one new hormone, which is the luteinizing hormone, which will signal the follicle to rupture and release the egg. And once this happens, then this follicle, no longer having the egg inside, has something called, it's called corpus luteum, or the main one that is going to start producing progesterone to kind of prepare the lining of your uterus to be pregnant. So here is when ovulation happens. So when this rupture occurs and the egg is released, is when ovulation pretty much signals the commencement of the second phase, which is the luteal phase. Name obviously given because of the corpus luteum, is when begins to work and secrete the main, or becomes the main source of progesterone until the entire cycle starts again. So this rise of progesterone begins to take place when ovulation commences. Like ovulation happens, progesterone starts being produced. Estrogen levels will still be high, but progesterone is going to start increasing as well. And this is going to probably, you'll see the highest level of progesterone happening in the late luteal phase. So I said we have early and late luteal phase as well. Luteal phase, the late luteal phase is the one that is kind of commonly known as the PMS, or the the premenstrual cycle.
Mm-hmm.
And symptoms is on this specific late luteal phase when you have really high progesterone, estrogen levels are relatively high as well, and then suddenly they fall. When they have this drop fall is when you start looking at a huge amount of cravings, a rapid change in mood swings, lots of different things, and this is very individual as well. But for the most part, this is what happens with your cycle overall. In the case that the egg is fertilized, obviously the corpus luteum stays around for longer, and then the placenta takes place over and is going to be kind of the main one controlling the hormones, the female hormones during the pregnancy.
Yeah.
If there is no pregnancy, then you will see that the cycle is going to repeat again. Now, if we think about looking at dividing the menstrual cycle in these four phases, based on estrogen and progesterone relative amounts,
Mm-hmm.
you'll see that in the early, if we divide it in four phases, early, late follicular phase, early and late luteal phase, estrogen in the first phase is rising, progesterone is low. In the late luteal phase, estrogen is high, progesterone is low. Early luteal phase, estrogen is high, progesterone is rising. Late luteal phase, progesterone is high, and estrogen is falling. So it kind of looks like they are relatively one higher to each other,
Yeah.
depending on the phase, and that's why it makes it different in each stages. And that's what you see in around ovulation and around or closer to your the start of the cycle, those changes in the body fluid dynamics, in mood, in how you feel overall. There is a lot of different things happening in the same time in these specific periods, where just the hormones are in specific places where they are doing the job as it should be. Now, one thing that you asked as well was around when women are either utilizing contraceptive pills or hormone replacement therapy. You will see that estrogen and progesterone, rather than having that regular natural rhythm, they will be pretty much steady and flat.
Yeah.
So you don't see those levels going up and down and moving throughout the 24 to 28 days, which is kind of the regular amount of time that a cycle would last. So you will see that it is very, very much a flat line of hormones. So those fluctuations are pretty much reduced, pretty much a minimum.
Yeah. I think that's a common misconception, and something that, for women who are on contraceptives or birth control, is that they think that they're experiencing, a period, right, during those placebo pills or during that monthly bleed. That's a withdrawal bleed. If that's the case, some women don't experience it at all. As well as, those hormonal fluctuations where you think, oh, I'm PMSing or my hunger because of my period. Well, oftentimes, like you mentioned, it's minimal, slim to none in comparison to a woman who is experiencing those menstrual cycles without contraceptives, where we talked about that roller coaster of the hormones fluctuating through each phase. So it is a question that, as a coach, you can ask your clients. And of course, when you are onboarding clients, whether you're working in person or online, it is important to ask on what, if there are prescribed any medications or things like that, so that you are aware if you are providing any information, it is not going to interfere with that. And of course, talking to a doctor is key to be able to, you're not a doctor if you're a PT, you're supposed to make sure that what you're doing is in line with doctor's recommendations. But something like this can give you the answers as a coach. If your client is on contraceptives, then they're not experiencing those fluctuations. So for clients that are experiencing those fluctuations, talk to us about expected hunger fluctuations, navigating nutrition during those spikes and drops, and then you can follow up with, is it optimal to adjust training for those phases, or do you kind of keep it steady throughout the entire cycle?
All right. So for your first question, how to navigate and how to manage appetite, hunger, cravings, mood. This is going to be so specific for each client that you really need to just connect with how they are managing in the first place and what are some of the key things that are happening in that period of time. Because obviously there is a big component of the stress that is, if they are in a fat loss phase and they're measuring the weight, the scale is going to be very tricky in these particular times when you're either close or near ovulation, or close near your day one of your cycle. Due to these increases and fluctuations of your weight, if you're really paying attention to how your weight is behaving throughout the week and you see a sudden increase, that can be a very challenging aspect for certain women, and that is when your role as a coach comes very handy to teach them why they shouldn't be so worried about that increase. That is not fat, that is not like they just suddenly the program is suddenly not working anymore, or that's something, there is something wrong with them. It is understanding and explaining what normally happens and be confident, you as a coach, to say, look, this is normal. I promise tomorrow, in a few days, your weight is going to come back down to what it was before. Stay consistent, trust the process. Things are going to be fine. The more you stress about it, the more you gain weight, because for two reasons. One, stress increases cortisol. Cortisol is a hormone that pretty much plays in that water dynamic fluctuations, and it probably can help or aid increasing that water retention. So if you're more relaxed about it, you just go about your life and stay consistent, your cortisol levels and your stress levels in regards or in response to the particular event is going to be much lower, and therefore your fluctuations may go even much more smoother. Secondly, if you're an emotional eater and you think that it is all over because you gain weight one day and you feel like all my efforts are for nothing, and then you sort of say, you know what, I quit, I don't care anymore, and I'm gonna eat that chocolate, and I'm gonna eat that pizza, and I'm gonna eat this, I'm gonna eat that, then you just ate 3,000-4,000 calories because you felt like it was not worth it, because your weight gain, you had a weight increase, and it had nothing to do with fat, but you thought it was. So this is a self-sabotaging attitude that usually seems to be very common in a lot of women, that seems to affect their adherence, their consistency, and obviously their results.
Yeah.
So these two things are really important, and that's why I say the more you stress about the change in the scale, the easier that you will see the weight go up.
Yeah.
Because of these two reasons. One can be true fat gain, just because you sort of felt this is not working, I'm just going to eat it all. Fuck it. And the other one is you're actually more stressed about it. You're thinking so much about it that your stress and cortisol levels are higher, your water retention is higher, therefore you're heavier on the scales. If you relax and you have a really good mindset leading into your cycle, you're going to be much more successful at keeping your weight relatively stable and navigating your emotional eating much better. If you do have cravings, there is research suggesting that you can definitely succeed and maintain your weight stable, even if you're in a fat loss phase, given that your late luteal phase is composed by a slight increase of your body temperature, and therefore your BMR or your energy expenditure is slightly higher, up to 150 to 200 calories more on that specific week. So that's why you probably have more cravings, or you're just hungrier. And you can give yourself permission to have that 150 to 200 calorie leeway or extra calories, with the one thing that you probably want to have the most, whether it's a craving for chocolate or whether it's a craving for something else. That's permission you can give to you and still be in the same deficit relative to your energy expenditure, or even just reducing the chances of feeling like you have to be so restrictive of you starving that can lead to a binge episode. Especially that we have to consider as well that this is a tricky period where your mood is probably not in the best state sometimes. So if you have a low mood, low self-confidence, you feel like you're heavier on the scale because you weighed this morning, like all of these different things can make the perfect environment for you to just say, fuck it, I'm just going to eat it all.
Yeah, and I think, to add to that, when it comes to cravings, if you're embracing that you're going to be feeling them, it really depends, right, what your goal is, what your approach is, and knowing that these times of the month are common and that they come for you if you experience them, but also adding to your toolkit of, one, honoring your craving, but also utilizing the tools of, maybe having high volume foods to satiate you, prioritizing your protein intake, fiber intake, all of those things that may help alleviate that humongous spike in hunger where you feel like you lose control, which we will have time right after your training recommendations during the menstrual cycle to really hone in efforts on talking about the relationship with food. And it goes without saying that it is really important to develop a healthy relationship with food and healthy eating behaviors. But before we go into talking about that, just briefly mention to us recommendations for coaches to imply when it comes to training recommendations during menstrual cycles. Does there need to be a shift or change during this time? And if so, what would that be?
So now that we have a better picture of the menstrual cycle overall, I think it is important to understand that there has been a few research papers analyzing and talking and addressing these particular facts, that whether the menstrual cycle can actually be important for periodizing the training phases, the intensity, the volume, and all of these things. And at the end of the day, there are women that respond well with that periodization, with higher volume, a higher amount of intensity in the first, like in the follicular phase compared to the luteal phase. But not every woman will respond the same. There are women that are pretty much good respondent regardless of what the phase is, for you to implement certain strategies in the training component or in the training program. And there are women that will be clearly more susceptible to those hormonal changes, and they will probably respond better to a more strategic periodization of these different factors that are part of a training program. So you can definitely see, based on the effects of estrogen and progesterone, that the first two phases are likely to be more optimal to increase volume, to increase intensity, or even work on a very good amount of training volume, and being in a calorie deficit and still being able to achieve a really good performance. When you're getting closer to ovulation and after ovulation, when progesterone levels are elevated and your basal body temperature is higher, fatigue levels seem to be higher, like managing stress seems to be harder. And this moment in time, women probably benefit more from switching to a more relaxed type of approach, where you have a little bit more focus on recovery, lower intensity exercises, more walking, less volume. Those things seem to be, for a lot of women, a typical pattern where they benefit with let's say, a higher volume initially, lower volume, lower intensity, but still maintaining some level of activity by increasing exercises that are more relaxing. They are focused more on stress management, stretching, maintaining their walking or their cardio without trying to go at levels of high amount of cardio. It's just like the training intensity and volume is sort of being adjusted as your cycle goes along the way. Some women benefit from having a deload week, or a few days with a lower intensity, or even no weight training whatsoever in the latest days closer to their period. And some women actually feel really good going into the gym and lifting on those particular days, because they still feel like that gives them confidence, makes them stronger, or just helps them drain that stress, or feel better overall, have a better mood. So coming back to what is the literature and the evidence says about utilizing these strategies to periodize, is really individualized. And some women will respond really well at doing this kind of approach, and some women will just respond very neutral to this approach, and they can do really well regardless of what cycle phase they're in.
Yeah, and just like anything, it's really, client dependent, and being in tune with your client. So really having a solid biofeedback system with your client, whether you're coaching in person or online, it's really important, so that, just logging weight or just, logging nutrition only says so much. I do think that there is a great value and importance for coaches to be asking questions on their check-in periods, to find out these types of things so that they are able to optimize their approaches with their clients to the best of their abilities. Now, we'll segue into a conversation towards the end of this masterclass about relationship with food and why that's so important. Talk to us a little bit about your experience with, rebuilding that relationship with food, and talking about key things that encourage lasting behavior change that us coaches can help our clients implement, so we can break the stigma of, fear of food, fear of certain food groups, fear of weight gain, quantities of food. So let's start having that conversation, because I do think it's not just prevalent in women, but also in men. So any client that you are working with could potentially be experiencing these type of mental and emotional attachments and behaviors with nutrition.
I think it is so broad that we gotta be more specific when we talk about our relationship with food, and just having an initial assessment of our dieting history, where we're sitting at the moment with our relationship with food. And when we think about what is having a relationship with food actually means, is what are you thinking about food, or how are you feeling towards something, to a certain food, certain behaviors, before, during, and even after eating. How are you approaching and you're eating? When you're sitting down, are you connected? Are you slowing down? Are you mindfully enjoying it? Or are you just desperately eating because you haven't eaten in the whole day, or because you just want to numb emotions? Why are you eating in the first place? And when you are eating, understanding not just the why, but how are you eating, and how fast? What are you thinking during that period of time before you eat? What are you thinking before you're eating? Are you thinking specific macronutrients? Are you thinking nutrient quality? Are you thinking enjoyment? Are you thinking everything at once? It is really important just to look at your relationship with food, not just like, oh, I don't even know what a relationship with food actually means. I think it's good, or is it bad? I don't know. So it is looking at those questions. What am I thinking, and how am I feeling during the day when I'm not eating? Am I thinking all the time about food, the quantities, what I'm going to eat tomorrow and past tomorrow, or if I have an event, what I'm going to eat, how am I going to fit that? And like, food occupies 100% of your headspace the entire day. Is that healthy? You really need to ponder that with yourself. Like, is it really something that is giving me quality of life? Am I with my partner and I am not enjoying the type of experience because I'm thinking, oh, I need to plan my meals for tomorrow, and I need to hit my macros tomorrow, or things like that. Obviously, we have phases, we have goals, and there are priorities in our lives, and there are going to be periods where your nutrition is number one thing you want to nail 100%, because you're prepping for a show, because you have a specific goal for a specific day, you get married, you want to just look better. But at the same time, you can do and achieve all your goals and still be compassionate towards the approaches you tend to choose to improve your body or your nutrition or whatever it is, and still bring and have in mind that at the end of the day, there is not a specific deadline, to be honest, unless you're competing for a contest prep or something like that. You don't need to put so much pressure on deadlines. And I do have clients, for example, I need to be hitting 58 kilos or 59 kilos by 3 weeks. And when you ask them why, I don't know, because I want to be hitting that. Okay, it's good to
Yeah.
have goals. It's good to know and have certain deadlines to stay accountable and stay motivated and work towards something. But you can't just always think that that is not, it's so rigid that if you don't achieve it by that day, it is all over. Especially if there is not like a true deadline, but you just put it in there just to be accountable towards
Yeah.
that day. If there's something, if that is going to prevent you from having a really good time away or creating memories because of something is more important, then I don't think you have to be that rigid to begin with. You can have another week. Well, let's give it yourself another week so you can still create your memories and still progress, feel less stressed about it. And then you have another week where you can just go slightly more aggressive or go harder, but you give yourself that permission. So it is being less rigid, have a more growth mindset, and understand that nothing is
Yeah.
black or white or 100%
Yeah.
or 0%. So you start from there. And once that is a little bit clearer, you can definitely start moving towards what really matters to you and how important your nutrition should be. And what are the pros and cons of being super strict certain times, and when you need to just give yourself unconditional permission to allow yourself to enjoy your food or enjoy certain experiences. I have gone through in my life through different phases, from when I thought I needed to be super restrictive with my diet to a point that I was having eating disorder behaviors, and on top of that, anything that I would eat, I thought I was going to get fat. That was what was in
Yeah.
my head. And I could look pretty good, but I was so
Yeah.
miserable that my life was just surrounded by thoughts around
Yeah.
food and exercise. I needed to earn my food. I needed to exercise off everything I would have eaten that I felt they were bad foods or things that wouldn't fit in a
Yeah.
healthy diet. And all the way across to where I'm now, that I give myself permission, unconditional permission, to have whatever I want, even though I don't have it, just because I don't think I need it, but not because it's off limits, but it's because I don't think that I want that right now. If I wanted to, I
Yeah.
can have it. I can eat it if I wanted to, but it's my choice now. It's not because it's been imposed or because there is a thought that is telling me that food is bad and you cannot have it, it's prohibited in your diet. No, now is my choice. I don't really want that because I prefer eating more nutritious, more filling foods that are going to make me feel
Yeah.
better, that I can then go and train to feel good about myself, have energy, and perform much better. So it's kind of thinking and eating intentionally with purpose on why am I eating this? What am I choosing these things? And for
Yeah.
what reason? So thinking about the outcome based on your choices sometimes is something that you don't get to that level until you have experienced a process of
Yeah.
learning and learning about yourself, understanding what do you like, what you don't like, what is good, what is bad, and there is going to be a period of relearning what is your own preference, what is your own preference, your likes, dislikes. And once you know more about yourself, then you're more able to transition to more intentional and have better decisions. Of course, having that extra knowledge and change in mindsets
Yeah.
towards
And
food. So hopefully that give you a little
yeah.
bit of a understanding or a brief of what I want to talk about when it comes to
Yeah.
relationship with
And I
food.
also think it's important to mention that there are reasons why we have these perceived notions of food. I myself struggled with it growing up due to just like that scarcity mindset that I thought that when I had something, I will never be able to have it again. And it would be that type of relationship with food where it was like, I don't have this often enough, where when I had it in the house growing up, I would eat because I knew that it would probably be a long time until I get that. And pinpointing that reason and understanding why my mindset was like that, I was able to understand, especially, coming into reflection with that, knowing that I now can go into the grocery store and buy whatever it may be that I am craving or wanting. And when you are exposed to that, you see a trend where you may not crave it as much, or that it's like you can have it at any time. So you can have a small portion and enjoy it and be present during having that, whatever it may be that you label as bad, or you used to have guilt over, and it becomes neutral. I think, seeing food as nutrient dense and food that makes you feel good, sure, but it's important to also have like neutral goggles when it comes to looking at food, and having that type of neutral verbal communication on certain foods, because especially if you have children watching, that is one thing that they will catch up on when you start labeling those foods as good or bad. So you want to be that good example for your children, for yourself. So again, it's really important to make sure that when it comes to, we lost Astrid. Am I the only one that doesn't see Astrid, everyone? Can you put it in the chat if you only see me, because I don't see Astrid any longer. Maybe she will come right back on, but okay, only me. We will wait for her to hop back on because we do have a few more minutes. But again, there she comes. We're going to wait for Astrid to come back. I'll just give her a few seconds for her screen to load. And then we can continue this conversation and wrap up our masterclass. It's loading. I'm not sure if you guys can see Astrid now. Astrid, can you see and hear me?
Yes. You me?
Yeah, you're back. Whoop whoop.
Yes.
Awesome.
I don't know what happened.
Yes. Riverside has been, technology is not our friend all the time, but to our students who stick it through, you the best. But like we were saying, relationship with food really comes down to, your feelings, your behavior, your language. And when you are encountering a client who has that food fear, when it's like quantity of food, type of food, it's really important to channel into like finding out why that they have that behavior, and working with certain tools. And I think I want you to talk about this because I have used this tool with myself and other clients, the tool that you have about your Kit Kats. Can you tell our students about your Kit Kat practice that you do?
So this is something that I use a lot, not just with myself, but my client. It is more related to that intentional mind experience when you want to allow yourself to have something that you really, really enjoy. You want, first of all, choose a good time where the environment is going to be permissive for you to have that time with yourself.
Yeah.
That there is no pressure, there is no one interrupting, no one distracting you, and you can actually hold onto that experience. When you're doing that, you actually want to start connecting with experience, even like from you opening into the sound of the packaging wrapped, and then smelling the food, having a bit of time of trying to remember or associate that smell with previous experiences, previous memories. It ignites your experience even more, because you're not just eating for the sake of eating, but because something brings you a really big from something you lived in the past associated with that smell or with that particular food. Then you want to go slowly and even have a small bite, and it's not like just bite and you chew it. You play with your tongue and the food, and you actually give time to slow down. And I don't know, I'm even imagining now that, and I really enjoy how pleasurable it is to extract everything from that small bite.
Yeah.
And just going super slow with that. And with the same experience, you do that with the rest of the Kit Kat or the chocolate or whatever you choose to do the experience with. It's not like a packet, it's a very small amount that you choose to have, and unconditionally allow yourself to enjoy that as much as you can. And you realize that when you do that, you're not just satiating or giving yourself to get into a potential craving or something that it is out of that 80% of your total nutrition.
No, we lost Astrid again, guys. Well, I'll follow up with what she was saying. I think really being present during your meals and when you're eating, encouraging that for your clients, not only for digestive issues too, being able to properly digest your food. Oftentimes we're on the go, eating quickly in between things, and we're rushing the experience of eating. And if you are encountering a client that is struggling with that relationship with food, sometimes slowing down is exactly what they need. And to be present, not distracted, not scrolling on their phone, not busy doing something else while eating, and just being slow while eating, I think is a wonderful tool to incorporate in a routine, regardless of the fact that they, have a healthy relationship with food or not. I think it's something that, especially nowadays when we're super busy, we're cramming things really quickly and we start losing the experience of actually eating. So slowing down while you are eating, I think, is a wonderful tool that we can recommend for clients, especially clients that do struggle with their relationship with food. Astrid, you're back. Let's go. We're almost done. We lost you again, but that's okay. That's okay. We're almost done. And I was just following up with saying how slowing down eating can really be beneficial, not only for rebuilding that relationship with food and being present, but also digestion. Thinking about, actually enjoying your meal instead of always being on the go and distracted. And sometimes, unfortunately, that is what we have to do. But overall, I think when it comes to relationships with food, it's about rebuilding that behavior and just perception of, what is the food labels that they have? What are the pre-notions that they come in with these things? And as a coach, you are that backbone of support to encouraging them to develop these habits and behaviors and taking it one step at a time. I think self-reflection is a big tool. And I think as coaches, having these moments where, something that I recommend for my team is, when you are eating something or you feel like you're about to overeat or binge, like they're two different things, but stopping in that moment and just taking a few breaths. And if anything, stepping away from a little, if you feel like you're going out of your control, and just being, in tune with yourself and being, will I enjoy this now and after? Am I going to feel guilt after consuming X amount of food? If you're not going to feel guilty and you really want to enjoy that in that moment, give yourself full pleasure to do so. But if you know that after eating X amount of food or this type of food, you're going to feel guilty, you might cycle into continuing doing that. Being reflecting on that can help you pause for a second and rethink, because what ends up happening, especially during periods of time of overeating and binging, is that mindlessness. We want to bring mindfulness back into eating behaviors. Astrid, can you hear us right now? Yes?
Absolutely.
Okay, you're still on. Good. So overall, I think that with all of our topics that we covered today, we gave a bunch of insight when it came to PCOS, pre and postnatal, menopause, optimizing nutrition for menstrual cycles, touched on relationships with food. We can only fit so much in our session. But do not worry, you guys. We have heaps of information. Astrid is always on our IG Lives. If this is popular and you guys are enjoying these conversations, we're more than happy to host more masterclasses with Astrid. Now, before I let you guys go, I will say Clean Health has an exclusive offer for all of our students watching that is going to be valid for 72 hours. If you check your emails now, you'll already see that offer there. You can save 40% off our Performance Nutrition Complete Certification using the code Astrid40. So this is exclusive to all of our students that are joining us live. When it comes to mastering nutrition, you have all the tools you need from PNC 1, 2, and 3 to help you really take, that leadership standpoint as a coach for your clients and embodying that, example as a coach, but also knowing how to navigate certain things when it comes, from the base level of calories in, calories out, all the way down to optimizing nutrition for neurotransmitters. So PNC is the complete certification. I'm not biased. I'm trying not to be. I did take it before being a part of the Clean Health fam, and it equipped me with all the tools I needed to take my coaching to the next level. So again, Astrid40 is going to be your discount code. You can see that in your emails now. If you want to rewatch this masterclass, we are going to, hopefully, even with the technology issues, put together the recording for this and put it up on our YouTube channel, which I can't recommend you guys subscribe enough, because there's heaps of free educational resources there for you, from masterclasses to educational videos. That is our hotspot for free education. And of course, following Clean Health Institute and Astrid and myself, we do put out heaps of free education for you guys. And if there are topics that you are wanting for us to cover, please let us know. Follow us on Instagram at the Clean Health Student Group, and follow us on Facebook, Clean Health Student Group, where we have our community have these discussions. I touched on everything. Hopefully you guys can hear and see me well. Thank you so much for joining our masterclass today. Astrid, always a pleasure talking with you. You are a rock star, and I know we gave such valuable information for our coaches, and I cannot wait to have yet another discussion with you.
Me too. It was amazing. Thank you so much for having me.
Of course. And we will see you guys again next time.